Pediatric Oral Hygiene, University of Louisville School of Nursing, by Patricia Hammond, Rachel Newland, Rebecca Nolan. The first toothbrushes can be traced as far back as 1000 CE in China, but the more common bristle brush was reinvented in the late 18th and 19th centuries. According to the National Institute of Dental and Craniofacial Research in the 1940s and 50s, researchers carried out clinical prevention studies for communities who were supplied by fluoridated water and discovered that a drastically lower amount of school children developed dental caries when compared to the control group who received but only a trace of fluoride in their water supply. This remarkable discovery inspired the United States to acquire widespread fluoridated water and became an inexpensive and preventative measure that continues to benefit in the control of dental caries. In the mid-1950s through late 1960s, dental sealants were developed from the technologies of enamel bonding. This use of dental sealants was later accepted by the American Dental Association in 1976. In school-aged children ages 3 to 12 years old who have early childhood caries, will application of oral hygiene education result in a decrease in the incidence of caries compared to children who did not receive oral hygiene education? Dental sealants are extremely important for the removal of decay from the teeth and the prevention of further tooth decay by creating a barrier against decay-causing bacteria. From the standpoint of dentists, the issue is that there are microscopic pits and fissures that exist in the teeth along the biting surface, which provides a perfect hiding spot for food and bacteria to get trapped in. The problem is that even the smallest bristle of a toothbrush cannot reach inside of these tiny cracks, causing an impossible removal, and in turn leads to decay. According to national estimates, as much as 90% of all dental caries in school children occurs in pits and fissures. The NIDCR discussed a school-based program that was conducted to gather statistics on the effect of tooth sealant. The control group did not get their permanent teeth sealed versus the experimental group that did, and were then assessed 5 years later. Results concluded that sealed surfaces suffered a low 10.8% decay rate, while the unsealed surfaces suffered a high 51.8% decay rate. Having dental sealants placed on the teeth is essential to prevention of decay and is almost 100% effective when it is fully intact.
Abby, how are you today?
Good.
All right, so I'm just going to look at your teeth to see if they're all healthy, and I need to make sure if you have any cavities, okay?
Okay.
All right, so if you would, lay back for me and open your mouth really, really wide. All right. Looks like we might have some cavities. Let me take a look, okay?
Okay.
Open up again. Say ah.
Ah.
All right. actually, you have 2 cavities today, okay? So I'm going to have to fill them, and what that does is it prevents any more germs from getting in there, making your teeth even more sick. And then after I do that, I'm going to need to sit down with you and your dad here, and we're going to have to talk about your all's normal habits for toothbrushing, all right?
Okay.
Okay. All right, guys, so we're just going to do this real quick. I'm sure you guys know what you're doing. Does she use the right type of toothbrush?
Yep.
And toothpaste, right kind?
Yep, she's got the correct type, and I make her brush every time she needs to. So.
Okay, so yeah, like I figured, you guys know what you're doing. I'm just going to send you on your way. Just come back with her in about 6 months for another checkup.
Okay.
During the 1980s, the research behind the use of fluoride was in full swing. While the use of fluoride was accepted universally, the literature began to be dominated by this idea, oftentimes leaving out the importance of oral hygiene education in general. The issue is that children and parents are being told to use fluoride and sealants to prevent and rid dental caries, but we have failed to teach the basics such as proper techniques of toothbrushing, the amount of toothpaste to be used, when to change your toothbrush, and how long to brush teeth. An article in the International Journal of Pediatric Dentistry presented a study conducted with a total of 434 children participants. The aim of this study was to better understand how children and their parents and guardians perceive dental caries and gum diseases such as gingivitis. The authors further expressed that understanding how children's perceptions of the disease and dental caries may predict their preventative behaviors will inform the development and implementation of any future oral health education and promotion programs for children. 42.5% of children did not think that they had to go to the dentist unless they had a cavity. 20% of children would stop brushing their teeth if their gums started to bleed. 50% of the participants believed that dental caries are a sickness and did not understand that dental caries are a chronic issue that will return unless prevention measures are taken. According to an article published in the American Journal of Public Health, children are susceptible to many chronic health conditions, with dental caries often being the most prevalent. According to a study done in North Carolina, children experience dental caries 5 to 8 times more frequently than asthma. Evidence shows that approximately 42% of children between the ages of 6 and 19 have had dental caries in their permanent teeth. It has also been noted that children who have poor oral hygiene are 2.3 times more likely to have poor school performance compared to those children who have had good oral hygiene.
Abby, it's time for bed. Go ahead and brush your teeth.
Okay.
Well, hey, Abby, I'm glad you're back for your checkup. I'm going to look in your mouth, and hopefully this time your teeth are perfect, okay?
Okay.
All right, let's lay back. Let me look real quick. Open real wide. Okay. Let me use these. Open again. All right.
Do you have any cavities?
Well, Abby, you actually have 2 more cavities this time.
How? She brushes her teeth every day.
Yeah.
You do brush them?
Yeah.
Well, maybe I wasn't very clear in my instructions the last time you guys were here, so I think what I'm going to do, I'm going to have my nurse come in and, she can go over exactly what you guys need to do and she'll talk you through it step by step. Does that sound good?
Sounds perfect.
All right, and just like last time, after she talks to you, we'll set you up for an appointment to come back in 6 months, okay?
Okay.
According to the article published in the Journal of Natural Science, Biology, and Medicine, most children do not visit a dentist until around age 3, but the proper education for parents is needed way before this time to prevent dental caries and the negative health effects that may follow. Although children do not visit a dentist until around age 3, most children have had up to 11 well child visits by this age. At the well child visit, the nurse should be able to assess the oral hygiene of the child, including
buccal mucosa,
odor, overall appearance, hygiene practices, any genetic oral disease or abnormalities, and knowledge level of the parent. Nurses being able to identify signs and symptoms of early dental caries or disease will help to prevent later negative outcomes. Untreated dental caries oftentimes leads to pain and discomfort, which then may cause infections, altered sleeping and eating habits, risk for hospitalization, and a decreased ability to learn in school. The Partnership for Healthy Mouths, Healthy Lives recommends that children brush their teeth 2min 2x. What this means is that children should brush their teeth 2 times a day for 2 minutes each time. Parents should allow their children to imitate them as they brush or should supervise the child's toothbrushing until they are at least 8 years old. Children should use a soft bristle toothbrush, preferably one that is small enough to reach all of their teeth, especially the hard-to-reach areas towards the posterior aspect of the mouth. The amount of toothpaste depends on the child's age. For children ages 3 to 6, the amount should be the size of a pea, and the amount should increase with the child's age. The toothbrush should be held at a 45-degree angle against the teeth and gums. Move the brush back and forth in short strokes. Have the children brush the front, back, sides, and top of their teeth. Have the child brush their tongue to remove all of the germs. Make sure the child does not swallow the toothpaste and spits it out once they are finished brushing.
I'm 6 years old. I know how to brush my teeth.
I'm not so sure about that, Kayla. I guess we'll see when she comes in and talks to us.
Hey Abigail, I'm the nurse. Hi Dad, I'm the nurse. I hear that we need some education about toothbrushing today.
I guess so. I mean, we thought we were doing it right, but the last 2 times we came here, she's had multiple cavities.
Okay, well, I'll first start off by talking about the type of toothbrush you're supposed to be using. For a child as small as her and her age, you want it to be a soft bristle toothbrush, and you want it to be smaller in size.
Okay.
And the next thing is the toothpaste needs to have fluoride in it. So fluoride is found naturally in the water, but it's also in the toothpaste you can buy off the shelf too. It's going to work to remove plaque and strengthen the enamel of your teeth.
Okay.
Okay, as for the amount of paste you're supposed to be using on your toothbrush, we like to say for a child 3 to 6 years old, about the size of a pea, or look at your pinky. See how little your pinky is? About that size, tip of your pinky on your toothbrush.
Okay.
Abby, is that about how much you use, the tip of your pinky?
No, I probably use like this much.
Oh my gosh, well Dad, I'm glad we're talking about this today.
Yeah.
Next I want to go over how long to brush your teeth. We typically give the rule of for 2 minutes, twice a day. So 2 days, 2 minutes.
How long is 2 days? How long is 2 minutes?
2 minutes? Well, I think if you and your dad find a song that you really like, then you can just brush your teeth for 2 minutes along with the song.
Sounds like a great idea.
Okay. And this is where we're going to need a lot of help on your side too. So I have some handouts for you that are going to go over the angle that she's supposed to hold the toothbrush. So she's supposed to be holding the toothbrush at about a 45-degree angle against her teeth and using soft, short strokes when she's brushing her teeth.
Okay.
We also need to make sure that she's doing the outer surface, the inner surface, and where she's biting to clean all those surfaces on her teeth as well. Like I said, I have these handouts for you, and you can cut those out and put them alongside the mirror. But what we have found helpful is if the parent goes into the bathroom with the child and kind of is just, just monitoring and watching to make sure she's doing it right or helping her out, because you never know really what's going on in that bathroom.
Yeah. I guess I could do that.
Okay, awesome. Do you guys have any more questions for me? Any questions, Abby?
I think we're good. Thank you.
All right.
Okay, Abby, so let's start with putting the right amount of toothpaste on our toothbrush. You remember what the dentist said?
Yeah, use this one as your pinky.
The tip of your pinky.
The tip of your pinky.
Yep. Okay, so go ahead and put it on. Well, that's about good. Oh, careful.
Whatever.
Here. Run it under just a bit of water. Do this thing. Here you go. So we put the right amount of toothpaste on our toothbrush. What was it? Just the tip of what?
The tip of my pinky.
Good job. And we ran it under some water. So now we're going to follow these steps the dentist gave us. Okay. So, let's see. We got the toothpaste. We got the steps. What else are we missing?
Missing.
Oh, the music. That's right.
The
Here,
music.
I'll play your favorite song.
So last time you were here, the nurse did some education with you, okay? So I'm going to look in your mouth and see if you got any cavities, okay? Let's hope that you don't, right? All right, open really, really wide. Let me look with these one more time. Wow, Abby, you don't have any cavities this time. That's awesome. So it looks like the education worked, okay? All right, that's all I need from you. Thank you.
when compared to the control group who received but only a trace of fluoride. Damn it! At the well child visit, the nurse should be able to assess the oral hygiene of the child, including... Cut! At the well child visit, the nurse should be able to assess the oral hygiene of the child, including buccal mucosa. They brush or should supervise the child's tooth brushing until they are 8.
Where's the fat fluffy dog? Come here, fat fluffy dog. There's a fat fluffy dog! Hey!
Mommy! You're so good at me!
Why don't you just come back in 6 months and we'll do another checkup? And that's it. That's the first scene.
You cannot put your hand in your mouth. I want you to sit up like a big girl. Now, Bubby is.
That's broken.
Abby, my name's Patricia. Frick, I can't do this. Are you serious?
100%. Yep. You're a minor.
I can't even see. I gotta duck my head down.
It's fine. It's just ridiculousness. Yeah.
Should I put it in there?
Just
Roll with it.
okay.
That would be even better if you put.
Come here, we got something else for you. Come here, we want to take a picture. Come here, let's take a picture.